Hi everyone, my name is Nidhi. I am a women's health physical therapist and I've been practicing for about 12 years. My focus is pelvic health. I work with women before pregnancy, during pregnancy, postpartum. I also work with women and men who are having pelvic pain, endometriosis, IC, different conditions that can cause pelvic pain. And all right, so I'm going to share my screen here. So pelvic, groin, and buttock pain during pregnancy. I'm going to repeat some of the things I said last time about posture and engagement of some of the muscles that we went over. So I'll go fairly quickly over that part because I already reviewed that last time. If you haven't seen that, there is a recorded video I can send you and then you can watch that one. But we'll focus more on the new things in this one. Okay, so pelvic, groin, and buttock pain can be multiple areas in the pelvis. So first, let's look at where can your pain be. First, a very common site of pain in pregnancy is the pubic bone pain. It's right here. Feels like the lower end of your belly, top of your vulva area sometimes. It's usually a sharp pain, comes and goes when you move around suddenly, if you get out of bed suddenly, sometimes if you cough or sneeze and there's pressure on this area, and that's the pubic bone pain or pubic symphysis pain. The second pain is on both sides of the lower end of belly. So it's higher than the bone. It feels like it's deeper. It feels like, even though it's sharper, it feels like it has a deep quality to it. Round ligament pain. Round ligament pain can be on one side of the belly, can be on both sides of the belly, sometimes radiates down into the vulva also. Third pain in this region is the groin pain or the hip pain, which typically feels like a deep groin pain. And it can be mostly with movement. So if you sit for too long and then you walk, or if you do a lot of steps, if you walk a long time, sometimes you'll get that pain. Back pain, this is the most common. There's like across the back sort of dull pain. This is more in the second trimester, beginning of third trimester, buttock pain, or some people know it as SI joint pain. This has a sharp quality to it. It is typically on one side, not both sides. Again, comes with quick movement. So if you're getting up from the chair and you move quickly, if you get out of bed and you move quickly, typically whenever you're changing positions. If you keep walking on even surface, it typically goes away. May not always, but typically does. Finally, the pain that goes down the leg, sciatica-like pain. The back pain, buttock pain, and leg pain, in reality, most women will have a mix of these pains. So it could be back pain sometimes that goes into the buttock pain sometimes that goes into the leg. So it mixes up quite a bit. While the pubic pain and groin pain tends to be in one position. So you won't get round ligament pain that radiates into your bone usually. It'll be one or the other. But here, the pain gets mixed up quite a bit. So when I review these conditions and how you can help them, everything that I'm going to talk about, the back pain, will apply to all three of them. So you're going to do the same thing, same exercises for all three of these pains to avoid them, or if you have them, to manage them. A little review, I went over all of these things in last module last week. So basically all the pelvic pain and pelvic back pain is coming from these four factors. First is altered posture. Your posture has changed, you're gaining weight, there's more arch in your back, the ligaments are a little bit loose, and again, it feeds into that altered posture. So if your posture was changing, now your ligaments are loose, it lets your posture change even quicker. Stretched muscles, progesterone makes your muscles stretched, all the abdominal muscles stretch, and then you have more weight. So all these four factors causes increased pain or predisposes you to pain during pregnancy. You can control weight, and that's important to gain the right amount of weight. You can't really control loose ligaments, but you can strengthen the muscles, and you can try to correct the posture. So we're going to focus on muscles and posture here. Weight is important to consider. Ligament is something that happens as a nature of pregnancy. All right, before I go into all of this, it's important to know to not self-diagnose pelvic pain or abdominal pain or even back pain if it goes on for a long time or if it's severe. So if the pain is persisting for a long time or if it's keeping you up at night, then you need to call the doctor. If it worsens with time, so every 2 hours pain is more, you walk up, you walk around, you try to put a heating pad, the pain keeps getting worse, you want to call the doctor. Again, if it does not change with position, you sit, you have pain, you stand up, you have pain, you walk around, you have pain, you stretch, you have pain, that pain doesn't seem to change, it likely not muscular pain, likely not skeletal pain, is more organ related. Comes in intervals, rhythmic or cyclical. So if there's a pain that's coming every few minutes or every half hour even, so comes for 10 minutes and then half an hour there's no pain and then comes for 10 minutes again, it could be a sign of early labor or preterm labor. Any pain that comes with any bleeding, change of discharge, any funny smell in your discharge, call the doctor, because this is the time you are more prone to bladder infections. You are more prone to UTIs, okay? So anything that hurts in the pelvic region or the back region can be an infection, also can be labor. Labor can present totally as back pain, no abdominal pain at all. It could be all back. So it's important to know these things and not self-diagnose your back pain or pelvic pain all the time. All right. So now let's discuss the first pain. I don't know why is this not here. Oh, there it is. Okay. So pubic symphysis pain. Pubic joint is the joint in front of your pelvis. So if this is the pelvis you're looking at, this is the bone on the right, bone on the left, bone in the back, and you see there's a tiny joint in the middle. This joint usually has a disc, a ligament, sort of think of it as a rope between these two bones in the middle. And it keeps it very stable. Usually before pregnancy, this joint does not have a lot of movement. These two bones don't move too much, okay? When this ligament loosens during pregnancy, now there's a lot more movement between these two bones. This is the case of a severe separation. Usually it's not like this, but this is a case of severe separation where the bones move apart too far. When there is more movement between these two joints, between these two bones, you need more muscle strength to keep this joint stable. Okay? And if you don't have that muscle strength, or if you don't have the right posture, this can hurt. The normal distance between these two bones is 4 to 5 millimeter. It can increase to 9 to 12 millimeter. It can increase to even more after that. So again, increasing the distance between these two bones is important because it's preparing you to be able to pass that baby through the pelvis. It's preparing you to be able to carry that baby in the pelvis, but it does present the challenge of now stabilizing this joint, okay? What is important to this joint is the muscles that attach here, because these are the muscles that are going to give you some stability. So 3 groups of muscles are the most important ones. One is the inner thigh muscles. A lot of inner thigh muscles will attach here. Hip flexors, the muscles that lift your leg up, will attach nearby. And then the abdominal muscles will attach on this bone here. The picture doesn't show the abdominal muscles. So all 3 of these muscles, when they're too tight, they can cause the pain. When they're too loose, they can cause the pain. So if the muscles are too tight, we need to gently work on these muscles that might relieve some pain, but ultimately we need to strengthen these muscles so they can support this joint. Okay, so short-term strategy could be to provide the stability to the joint from external means by a belt or by working on the muscles, but long-term strategy is to strengthen these muscles so it can support this joint better. Okay, and I will go over the posture and positioning later together. The second pain is round ligament pain. The round ligament is a ligament of the uterus. So again, a thick rope that attaches the side of the uterus to the pubic bone and vulva. Okay, so as the uterus grows and grows out and up, this ligament gets stretched. Okay, that's normal. Some of the fibers or some of the part of this ligament is stretchy. It's like muscle. So contractile tissue in this ligament makes it prone to spasm. So sometimes uterus is growing up and out, and the pull on this ligament causes the ligament to spasm and cause pain. Okay, pain is usually sharp or stabbing like, and it usually lasts for only a few seconds. Okay, usually during the quick change of movements, and we'll tell you what to do about it a little bit later in the presentation. Okay, one of the things that really affects round ligament pain is posture. Maybe I could go over here. Sorry. Okay, so posture is one of the main reasons for strain on the round ligament. When the uterus is growing, it has to grow out of the pelvic cavity into the abdominal cavity. Now, it has to grow up and out, so up towards the head and out towards the belly. We don't want the uterus to grow straight out, okay? We want it to grow up and out. So if your posture allows the uterus to be more positioned up and out rather than straight out, there tends to be less strain on the ligament. So some of the postural strategies that I will go over a little bit later can help this pain because it will decrease the pull on the ligament by having the uterus a little bit more up and not all the way out. So if you see this posture here, where the pelvis is really facing down, the front of her pelvis is much lower than the back of her pelvis. What that does is, uterus is right here. Uterus will, this slope of the pelvis will let the uterus fall more forward. And if she had more neutral pelvis, there is a chance that the uterus would still a little bit more vertical, and that more vertical positioning of uterus can decrease the strain on round ligament. And I will go over how to correct that posture in a few minutes. Okay. Hip and groin pain. Hip is, half of the hip is pelvis. So, and that's why I want to discuss this here in this presentation. This is the hip joint here, okay? This is the thigh bone, this is the pelvic bone. And you can see that the thigh bone gets inserts or attaches to the pelvic bone to form the hip joint. So when this bone, your pelvic bone, changes alignment, the thigh bone changes alignment, right? So hip is half pelvis. And when you correct the hip or strengthen the hip, you really help the pelvis. Hip is also huge in pregnancy because it's one of those places where you can strengthen those muscles and help the pelvis. Pelvis is going to get looser. Abdominals are going to get looser. You can't really help that because baby is right there. It has to get bigger, it has to get looser. But hip has a unique advantage that it's close to pelvis, but there is no baby here. It doesn't have to accommodate the baby. So strengthening of hip muscles, whether it's inner thigh muscles, quads, flexors, glutes, all of those hip muscles is the key to preventing hip, back and buttock pain in pregnancy. So strengthening hip is hugely important. The reason hip muscles often get pain is because pelvic muscles, the pelvis tilts forward. As the pelvis tilts forward, there is more strain. Again, this picture here, as the pelvis tilts forward, there is more strain or more work needed from the front of the hip muscles. So hip flexor muscles, the muscles that lift your leg up, get more work constantly. And they are able, if they are not able to keep up with this work, they can get tight or strained and cause pain. Typically, the pain is a sharp pain in the groin. okay? Hip usually have more pressure from pelvis during pregnancy as the weight increases and often causes overworking of the flexor muscles. Front of the muscles will typically get tight and get pain. Back of the hip, which is the glutes or buttocks, will typically get weaker. And strengthening the back and stretching the front is usually the strategy to relieve some of that pain. Finally, buttock pain or sacroiliac pain. So buttock pain typically is that pain I think I mentioned at the beginning. This is one of the common pains in pregnancy. This one here, okay? It's felt close to your pelvis, but not at your pelvis. It's like right below the spine, and it's usually on one side, it's usually sharp and does not often go into the leg, will stay in the buttock or maybe go down to the side of the buttock, but not all the way down into the leg. Okay, so when these joints get looser, and I mentioned this in the last module, when these ligaments get looser with the pregnancy, there's a lot more demand from the muscles of this region to stabilize the joint. So there's a joint between this bone and this bone here. There's a joint between this bone and this bone here. As you progress through the pregnancy, the ligament called relaxin will cause these ligaments to get looser. Hormone called relaxin will cause these ligaments to get looser. As these ligaments get looser, what tends to happen is the muscles around these joints have much more work to stabilize this joint now, right? And if these muscles aren't able to keep up, they can cause pain. One thing to note about SI joint pain is just because there's relaxin doesn't usually mean that you will have pain. All the ligaments are getting looser. So these ligaments are also getting looser. But research shows that one side getting more looseness or more laxity than the other side tends to cause pain more than the looseness of both sides. And why would one side be looser than the other? Is because if you have a pre-existing injury on that side. So like I said, ligaments are getting looser, muscles have more work to do. If you have pre-existing, if you had sciatica in past, if you had back pain in past, if you had hip tendonitis in past, if you had knee surgery, you had an ankle sprain, anything on that side, if you had in past, is going to decrease the buffer you have to stabilize this joint now. And that typically shows up as pain on that side. So it's not necessarily just because you're getting looser, it often is that you're getting looser and then your old weaknesses and old injuries start to show up on that side. So it's very, very important, one, to report all your symptoms to your therapist, tell them what history you have on that side, on both sides. And before you get pregnant or in your first trimester, really start to work on stabilizing and managing some of those weaknesses you have on that side. So if I have a chronic ankle sprain on the right side, I'm going to start stabilizing my ankle. If I have an ACL surgery on that side, I'm going to start strengthening my knee. If I had sciatic on that side, I'm going to start doing my exercises for managing that pain. Even if the pain is not there, it's going to predispose you to having pain during this time. Okay, so that was sacroiliac pain. 3 groups of muscles will help you stabilize this joint. One is abdominals, okay, and we'll go over how to engage the abdominals. Glutes, the back part, the buttock muscles. Deep rotators of hip, which is also glutes in a different way, engaging. All 3 of these muscles, group of muscles in the back, will help you stabilize this joint and take over the work that the ligaments are not able to do. Both in pubic symphysis pain and sacroiliac pain, massaging the area might feel good for a little bit. Okay, you might get a massage and feel like, oh, it's loosening up and I'm feeling better, but usually will not relieve the pain for long term. Okay, the muscles got tight because they were trying to work too hard to stabilize that joint. So when you work on those muscles, the pain decreases. But as soon as you start walking or you walk 2 hours, something has to still work. So very often that muscle will spasm again and pain will come back. or it'll feel better when you're getting a massage, but as soon as you get up, there is more pain. I have patients who say that, while getting the massage, I'm good, I feel better, but then by the time I get home, I have that pain again. And that's because the underlying cause is that there's weakness. The underlying cause is that the joint needs more stability, and more stability will only come from exercising and strengthening. It won't necessarily come from loosening the muscles. Loosening the muscles, getting a massage is all for pain relief. Ultimately, you will have to strengthen. And that's what I say, even if you cannot get a massage, cannot relieve the pain, strengthening slowly will help the pain regardless. All right, so posture, you're gonna correct the posture for all of those pains, okay? So if you have any of those pains, posture is going to be relevant. This is a typical posture in a pregnant woman. Like I said, if you think of pelvis as a bowl, her bowl is tilting forward. Okay, the front of her pelvis is a little bit lower, the bone in the front, and the bone in the back is a little bit higher. As she gets more and more pregnant, it will be more and more forward. There is typically a big arch in her back. The arch is deepened a little bit. Her upper back is typically leaning back because for this arch, she has to compensate. So she basically takes her upper back and leans back. The knees are typically locked and feet are typically turned out. She doesn't show turned out, but typically it's like this. So feet are turned out, knees are locked, pelvis is tilting forward, there's arch in the back, okay? What this position does is puts a lot more weight in the front. There is more weight in the front by default because the baby is here. But you taking this posture is going to really strain the joints in the front or tissues in the front. So what was in the front? The pubic symphysis was in the front, round ligament was in the front, hip joint was in the front. So all of those front pains tend to get worse by this posture. Correcting this posture just from the pelvis can relieve some of those pains. So I'm going to go over that first. Sorry. Okay, so this is another example. This is me. I'm not that pregnant, but you can already see there is a slight forward tilt in my pelvis, and this is me while correcting. What this and this shows is this is the uterus. I'm not very pregnant, so you can see clearly this is the uterus trying to come forward, right? When I give into this posture. When I correct this posture, the uterus is sitting a little bit more vertical and the weight is distributed across the pelvis a little bit better, okay? My knees are locked here, my knees are not locked here. And that's the correction we're aiming for. All right, so I'm gonna show you how to correct the positioning of the pelvis. Both hands on the pelvis. And the cue is think of making your tailbone a little bit longer, okay? So here it is. Think of making your tailbone a little bit longer. I breathe out when I do this. I am not gripping my abs. I am not thinking about tightening my abs or tightening my butt at all. Only thing I'm thinking about is making my tailbone longer and breathing out. When I breathe out, my abs will engage automatically a little bit, okay? It's easier to do in standing position when you're early in the pregnancy. As you get later in the pregnancy, in the third trimester, it will be hard to do in this position because you might feel off balance. So this position is a lot better. Leaning on the wall with your knees bent. The cue is make your tailbone longer. Make your spine longer. You're going to breathe out. There will be very gentle contraction of abdominals. So you'll see my belly goes in a little bit, but I'm not trying to do that. That's just happening because of the other two cues. So remember the cue, make your tailbone longer, make your spine longer while you breathe out. Okay. And one more position is lying down. Same exact thing. Okay, practice it in as many positions as you can. You're not going to be able to always maintain that perfect posture I showed you. I can only maintain it because I'm 20 weeks pregnant here. Now I can't. So the idea is not for you to maintain this perfect alignment of your pelvis all the time. The idea is for you to not hang out in this position all the time either, right? So if you can correct the position of your pelvis maybe 5 times, 6 times a day and hold it for maybe a minute or two, your muscles are going to get a little bit more feedback. Your body is going to get a little more feedback about this position. So as you progress through the pregnancy, you're less likely to keep feeding into this position and land somewhere in between the two. Okay, so you're not going to get to 100% correction, but let's hope you get to 50% correction, which is still good. All right, so that's the pelvic correction. Now let's go over the positioning. Positioning is important again for all pains of pregnancy. Doesn't matter if it's in your back, if it's in the pelvic region, if it's in the pubic region, all pains of pregnancy, sleeping becomes important. Positioning in bed, it becomes important. A lot of my patients have that big pregnancy pillow and they don't use it because they don't like it because it doesn't really help. Okay, so what I typically suggest, and I use myself, is 2 or 3 different size pillows that you put in different places to support. The only principle here is support, support, support. Support everything you can so there is least amount of pull on your spine and your pelvis as you sleep. In this time, your pelvis is a little bit wider. Everything is a little bit looser. Everything needs more work from the muscles. And when at night your muscles are not active, this pull can really create a tension or a torsion on your spine and your hips. So by positioning with pillows, what you're basically doing is giving everything stability, giving everything support, so there is least amount of pull on that spine and your pelvis. Okay, so there is a pillow under between her legs, and you can see the pillow doesn't end at her knees. The pillow goes way beyond her ankles. Okay, I see women have a pillow typically between their knees, but it's not between their ankles, and that causes rotation of the hip. So what we want is a pillow that goes all the way from your groin to your ankles. Okay, long, thick pillow, sort of firm pillow because your legs get heavier. So long, firm, thick pillow between the legs goes all the way from the groin to your ankle. A towel or a pillow between your under your back, and this extends to the front, so it extends to the belly, right? So as the belly is here, we don't want the belly to pull your spine down at night. So what we're doing is this towel under your belly is basically just going to raise the belly and give it a little bit support. And this towel, pillow is usually too big, this towel is going to help decrease that pull on the spine. Okay, there is a pillow that she's hugging. You can hug a pillow, or you can just keep one of those big towel rolls if you want. You just don't want your arms to fold forward, because if there was nothing here, her arms will fold forward and she will tend to turn. So to decrease that tendency to turn, a pillow is helpful. Traditionally, we have said that sleeping on the left side is better, and that's not because of pain, that's just because of the blood flow. But more and more research is showing that sleeping on both sides is fine as long as you feel fine. So if you have any symptoms at night of dizziness, shortness of breath, or just uncomfortable, roll onto your left side. But if you are fine sleeping on the right side, that's okay. And I'm saying that because some people have pain on the right side, on the left side, and they don't want to sleep on the left side. So you can sleep on the right side as long as you have no symptoms. Okay. The second big time when the round ligament pain and the pubic symphysis pain and even the SI joint pain happen is when you get out of bed. Okay, that is the most common complaint my patients have. They say, it takes me 10 minutes to get out of bed because I'm in so much pain. Okay, typically how we get out of bed is we do sort of a sit up and then we roll at the same time. So you're getting up and rolling at the same time. And that motion is typically too much motion for the painful joints to tolerate. Okay, so if you're going to break them down, this is how we do it. So if you're laying on your back, You're going to keep your feet together as much as possible, knees together, and you're going to roll onto your side. So from here, you're going to end up here. Once you roll onto your side, drop both legs over the edge of the bed. Then take this hand and push into the bed. So take your hand and push into the bed. Use this hand as your power to push yourself up. And then there you are. Typically with this strategy, you usually don't have pain. If you do have pain, even doing this, slight engagement of your abdominals can help. So think of doing a Kegel. Think of like you have a tampon inside your vagina that's falling out, and you want to hold that tampon in. So as you're laying there, think about engaging your pelvic floor or pulling that tampon in, hold that tampon, then roll onto your side, push with your hand and come up. You can do the same exact thing when you get into bed, just reverse it. So from here, she's going to put her hands on the side, lay down, then she's going to swing her legs up, and then she's going to pull the tampon in and then roll onto her back. Okay, you want to keep the knees and feet together as much as possible. That's the idea. You don't want to let this leg do one thing and this leg do the other thing. If you can keep the legs together, the pelvis stays a little bit more stable, and then you can use the strength of your legs and arms to get yourself up rather than having to twist through the pelvis. You don't have to do this if you're not in pain. This is a pain strategy, but you should practice this earlier in the pregnancy just because it's a thing that you have to learn. So if you're 37 weeks pregnant and you start getting pain, it might be hard to do this. So practice this a few times if you don't have pain, so that if you have pain, you can do it and be okay with it. It's a skill, just basically learn it. All right, so we went over the postural correction and pelvic tilt. All right, so this is the postural correction in big picture. I went over this last module, so I'm not going to repeat in a whole big detail, but these are the 4 important points of correcting your posture. You're going to soften your knees, shift your weight onto your arches, roll that pelvis back. So you can think of making your tailbone longer, okay, and breathing out. And then you're going to take your hands, put it on your breastbone, and pull this down. And this is because typically the pregnant posture is when your upper back is too far back, right? And your pelvis is tilting like this. So there's a big arch here. So we want to correct the pelvis, but then we also want to correct the upper back. And if you want to know more details about this, I explained this in detail in the last module. I just don't have time to repeat it again. All right. So now let's go to engaging the deep core muscles. We want to engage the deepest layer of your core. Core is the midsection, basically. Everything below your head and everything above your pelvis is your core. And if we take away all the muscles of your core, 4 muscles are the deepest muscles of your trunk. And these deepest muscles are the one that are the most important and give stability to your back, to your organs, to your pelvis. The 4 muscles are transverse abdominis, which is an abdominal muscle, pelvic floor, okay, it's inside the pelvis. Again, I explained this more in detail last module, and I'll go over it again in future modules. Diaphragm, which is under your rib cage, it's the breathing muscle. And multifidus, which is a muscle that basically wraps around your or intertwines between your spine. Okay, so it's a small muscle of your back. And you don't have to know all the muscles. Basically, what I'm saying is that engaging the deep core, when I talk about this, what I'm going to try to do is to get you to engage all of those muscles, okay? So you're going to do a little bit of Kegel, you're going to do a little bit of breathing, you're going to engage a little bit of abdominals. You do all of them together because they feed into each other, and all of them are important for the function of the other. So if you have back pain, you're going to still need to activate your pelvic floor. If you have leaking, you still have to activate your abdominals, right? If you can't breathe, you still have to activate your pelvic floor because they all work together. That's the idea. So how to engage your deep core muscles? Laying on your back, place hands on your pelvic bones. So if you go on the sides of your pelvis, you will land on 2 bones. Your hands are on your pelvic bones. You're going to breathe into your belly. Okay, so don't breathe into your chest. Doesn't have to be a deep breath, doesn't have to be a big breath. Don't blow up your belly. Just quietly, slowly breathe into your belly as much as you can. Okay, and then as you breathe out slowly from your mouth, you're going to blow like a candle. So don't cheat on this. You're going to blow like a candle, like this. As you blow the air like a candle, you're going to think about pulling those 2 pelvic bones together. Okay, they're not going to move. The bones are not going to move. I'm going to show my hands are moving just to show the direction of pull. You're going to think about pulling those 2 bones together. At the same time, you're going to think about pulling your tampon in. So if you had a tampon in your vagina which was falling out, you want to pull that tampon back in. That's the idea, okay? So it's not a squeeze at the vagina. We're not asking you to squeeze. I'm asking you to pull or lift just a little bit. All right. So let's watch. Breathe into your belly. Breathing out from your mouth. Think of pulling those bones together. Also, think of pulling the tampon up and in. One more time. Okay, so when I breathe out and I think of pulling the tampon up and in, my belly does get flatter. Okay, I'm not trying to make my belly flatter. I'm not thinking of gripping my abs or sucking my belly in. All I'm thinking of is those 2 bones together and the tampon in. And that automatically with your breathing should make your belly a little bit flatter. Okay, so do not grip your belly, do not suck in your stomach, do not hold your breath. All of those things will make you not use your deep muscles, but will make you use your superficial muscles, which is not what we want. All right. I'm going to show you in a different position here. That's a standing position. Again, lying down position, flat tends to be hard later in pregnancy. So you can use 2 or 3 pillows to raise yourself up. But I won't do it in a couch where your back is rounded because it's harder to engage. So if lying down, any position is very hard later in pregnancy, do it sitting in a chair or standing against a wall. Standing against a wall is usually a good position. So same exact thing, hands on the pelvis, breathing in. As I breathe out, those 2 hands I'm thinking of pulling together, and I'm thinking of doing a Kegel or pulling the tampon in. I always say pull the tampon in, not a Kegel, because in a lot of women I see when I say Kegel, they either squeeze their inner thigh or they squeeze their vaginal opening. We don't want that squeeze, okay? We want a lift. So we want a gentle imagining that something from the vaginal opening is lifting up, okay? So lifting up and coming from the side together, kind of what we want as you breathe out. One more position is all fours, which is again good for later in pregnancy. It's a little bit hard because again, if you have a big belly here, when you engage the muscle, you have to work against the gravity. So it's not always the easiest thing to do, but there it is. Okay. Practice all positions. One position is not better than the other. It just depends on time of the pregnancy, depends on your symptoms, depends on you. Sometimes some people find it very hard to engage in any other position other than sitting, and that's okay. Practice in as many positions as you want. How many times should you do this? You should do this 5 to 6 times a day, maybe 3-4 times each time, okay? So this is not an exercise. I'm just asking you to connect with that deeper part of your core so that you can do more exercises by engaging this way, okay? So this is the basis. You're connecting with those 4 muscles that are hard to connect with during pregnancy. So you're gonna practice this 4 times, 5 times a day in different positions. You can do it walking, you can do it sitting, you can do it standing, you can do it all 4s. And then whatever you do in your life, let's say you have to bend over and pick up something, that's the painful thing, then you do all of this and then you bend over. and pick up something. So hopefully it will engage your muscles enough that the activity that was painful is less painful. So if you had pain getting out of bed, you're going to do all of those things and then you're going to try to get out of bed. If you had pain going up the steps, you do all of those things and then you try going up the steps. So this is not an exercise to do during the day. This is an engagement strategy for you to tap into that part of your muscular system so that you can engage this system and do other activities. If you like a fitness class that you like to do, Pilates, aerobics, whatever, but it's causing you pain, try doing these things and then do that activity, whether it's squat or it's lunge, do whatever you want to do, try this. It may not always work, but most of the time for daily activities, getting out of bed, picking up something from the chair, getting in the shower, it will work. All right, I said in the beginning, this is mostly for hip. So if you have groin pain or hip pain or front of the thigh pain, this tends to happen because there's more weight in the front and your pelvis is tilting forward. So after you have corrected that pelvic tilt forward, these two stretches can help stretching the front of the muscles. There are a million different hip flexor stretches. I'm doing these two because they are easy to do in pregnancy. Okay, so you're basically trying to stretch the front of your thighs. I'm tilting the pelvis backwards, then leaning forward. You should feel it in the front of your thigh here. Yep. Hold it for 30 seconds. Do it multiple times in the day. Hip flexors are going to get tight in the pregnancy no matter what you do because the position of the baby is in the front. So your front muscles are going to work more. You can't avoid that, but if you regularly stretch these muscles and strengthen your hip muscles, then hopefully the tightness won't lead to pain. Same exact stretch, done in a different position. This is a little bit more quadriceps biased, or the thigh. You're gonna pull the leg in and then slowly swing the leg back. I'm always tilting my pelvis in, so I'm tucking my tailbone in so I don't get that huge arch in my back. Right? This is a stretch for the buttock muscles. Okay, it's important very often for that sacroiliac pain or the buttock pain that you sometimes get. One leg on top of the other. You're gonna hold the bottom of the leg and pull up. Can be hard later in the pregnancy. There's a way to do it in sitting. You just basically cross the leg and lean forward. And you can do that way if that's the thing. All right, one exercise I'm going to show you, and this is a very basic bridge. It's very important to strengthen the buttock muscles. I can show you a bunch of stretches, strengthening exercises here in a short presentation. But my idea here is stretch the front of the hip, strengthen the back of the hip, strengthen the butt muscles, strengthen and activate the core muscles. So if you have activated the core muscles and then you do the bridge or this activity, hopefully you can engage the buttock muscles. Buttock muscles are important to maintain that neutral pelvis I showed you. Remember, the pelvis was tilting forward, then we corrected it to neutral. That neutral alignment, you can correct it, but the only way it will stay for a longer period of time is if your butt muscles are strong and your ab muscles are working. So engaging that deep core and strengthening your buttock muscles is important. Here we go. Breathe in. As I breathe out, I engage the deep core. I breathe out, like you can see, I'm pulling the sides together, pulling the tampon in, and then I lift up. And on my Instagram, I've shared a bunch of glute exercises for buttock pain. I have 2 posts where I've shown you different versions of bridge. So once you engage the deep core, you can progress to those exercises. It's on my profile, maybe two weeks ago. And same thing, I've shared a bunch of exercises for pubic symphysis also, and you can watch them as well. All right. Finally, so these are all the ways, one, to prevent the pain from coming. Okay, so posture, engaging the deep core, those things are so the pain doesn't happen. If the pain happens, you can try all of those things. If the pain is mild enough, it will be helped. If the pain is more significant than that, you're going to need physical therapy. And with physical therapy, we can basically change the alignment, improve the alignment, release some of the muscles that needed to be released, strengthen more muscles that need to be strengthened. So physical therapy is obviously the gold standard for getting care, because all of these guidelines I gave you are very general, right? So everything I said is general. You are different. One person is different than the other person. One pregnancy is different than the other pregnancy. So this is more for understanding the basics. But if you are in pain, especially if you are in pain like round ligament pain or pubic symphysis pain that's significant, you want to get to a physical therapist so we can take care of it. I don't think I showed the belt. Sorry. Just occurred to me. There, okay, sorry. So external support or belts, the pregnancy belts, can help, especially the pubic symphysis pain that was happening in the brain front. Sometimes even the round ligament pain can be helped, and then the buttock pain. All three of those pain typically can be helped if you correct your posture, if you engage the deep core muscles, and you use a belt altogether. Usually the pain will decrease at least somewhat. So the brand I prefer is Cirola belt, which is the one I'm going to show you here. There's also a baby belly pelvic support, which is made by a physiotherapist, Diane Lee, and it's a pricier one, but if you have significant pain, it's worth it. Cirola belt is cheaper. So that's the one I'm showing you here. The belt has 4 sections to it, and this is how you put it on. It also comes with directions, so you don't have to basically follow this, but I'm going to show you where it goes. So the middle of the belt is going to go on your buttock, where your buttock starts. So it has to be on a bone, not your back. It has to be on a bone. Then you're going to pull it tight, and it's going to go on a bone on the front, not on your belly. It has to be on the bone. And then there are 2 Velcro straps. You pull them, and then you pull them together. Okay, basically takes your pelvis and pulls it together. It gives you a little bit feeling of pulled together. It has to be on the bones on all sides. Okay, make sure it's not on your belly and it's not on your lower back. The good thing about this belt I like is that it's not on your muscles. So because it's not on your muscles, it's not doing the work of your muscles all the time. You don't have to wear it all the time. You definitely don't have to wear it if you don't have pain. It's a pain strategy. So don't wear it just to prevent pain. You wear it if you have pain. The best thing to do is wear it and then do the exercises. Once you wear the belt and you do the exercises, you can do the exercise a little bit better, right? So let's say bridge was hurting you before. After the belt, the bridge doesn't hurt anymore. That makes you be able to do that bridge and strengthen that muscle. So hopefully you can wean off the belt. So belt is not the long-term strategy, but it is a short-term help, not just for pregnant women, also new moms, because they also have that a little bit of instability in the pelvis region, to pull it together and help you get stronger. That should be your goal. Help you get stronger so you can get off the belt. Use it when you're taking the baby for a walk, use it in the mornings, use it basically whenever you expect to have pain. All right, I think that's it.
Thank you very much. Now, let's say I will accept the questions. If any previous questions, and then if somebody has a question, raise a hand or just jump into the chat, please.
Okay, can you hear me now?
Yes.
All right, so we have some questions, Nidhi.
Yeah.
So the first question is actually not related to pregnancy, but I'm gonna ask you anyway. So this person is experiencing low back pain. She does experience low back pain during her period, and which becomes severe for the first few days. And are there any factors that cause severe pain during pregnancy? During period? Yeah.
So yeah, back pain during period can be related to the ligaments of the uterus. So uterus sits inside the ligaments, uterus sits inside the pelvis and has these ropes basically attaching to all sides of pelvis. So sometimes if one of these ligaments is tight or uterus is not in the best mechanical position, then when the period comes and the uterus has to engorge and get bigger, sometimes it spasms, then it pulls on these ligaments and causes back pain. That is the most common cause of back pain if it happens specifically during period. So mechanical, basically alignment and tension across the uterus can be one reasons.
Okay. Do you want to go over those questions in the chat section first?
Sure.
Yeah.
Are there any exercises you wouldn't recommend doing with SI joint pain? So in the beginning, in acute stages of pain, I wouldn't want to do a lot of asymmetrical activities, right? Because we said it typically is that one side is much more lax than the other. So if I'm just starting with somebody, I'm not going to give them lunges. I'm not going to give them single leg bridges. Not that they're wrong, but general idea is that you're going to start with something that is more symmetrical. And then as they get better, you want to include asymmetrical motions. So single leg standing or balance work. But acute stages start with symmetrical work and then progress towards asymmetrical work. Same things, start with low impact exercises and then progress towards high impact exercises. It really depends on pain. I don't think there's anything that you shouldn't do. But if you are in acute pain, start from a place of symmetrical movements and move towards asymmetrical movements. I hope that answers your question.
Do you recommend the SI joint belt during exercise if that's causing a pain? Or
yes. I think you should use the belt. If it helps you exercise, absolutely use the belt. So let's say she's not able to do lunges, but if you put on the belt, now she can do the lunges. So definitely preferred that way. I won't put the belt before I have taught them engaging their core muscles, right? So we don't want to give them something else. Absolutely, we want to teach them the muscles to use. But once they have that, if extra help from a belt can help, then yes, use the belt during exercises.
There's another one. So it says, how can episiotomy affect patients with vaginismus or hemorrhoids?
Yeah, good question. So episiotomy depends on the grade, right? Generally, patients with vaginismus can get affected negatively because of episiotomy, even if the episiotomy is not very high grade, just because there's a trauma there. And vaginismus patients typically have a pattern of guarding their pubovaginalis or their vaginal muscles, basically. So any trauma there, any experience of trauma there, or fear of trauma there, typically will make their pain a little bit worse. It necessarily doesn't have to do with the tissue. It has more to do with the response, like the trained response of pain. Grade 2, 3, 4, especially 2, 3 are muscle injuries. So they cut through the ischiococcygis and bulbospongiosis, and then not ischiococcygis, I'm sorry, the ischiocavernosus and bulbocavernosus. When they cut through those two muscles, those are the muscle injuries. So when the scar forms there, you have to work on that scar to help that, basically the stretchability or the flexibility of that tissue. So you have to work on that. Hemorrhoids would be affected in grade 3 or 4, again, because it extends into the back part, the anal sphincter and the rectal mucosa a lot more. So 3 or 4 would be affected more by that. But any grade of episiotomy tends to create a guarding response inside the pelvic floor. And if the pelvic floor is guarding, tightening against any work, then the sex will be painful and bowel movement may be painful. So there's a lot of training against that guarding mechanism after pregnancy.
Should I keep going?
Yes. And I think
All
that
right.
I don't see questions. So
yeah, no more in the chat section. So going back to, can pelvic pain in general after pregnancy go away on its own? Or do you always need to get PT? This is from general population question.
So it's hard to say. I mean, I think the pubic symphysis pain and round ligament pain will probably usually get a little bit better as there is less pressure on the pelvis. But typically the back pain and SI joint pain necessarily won't, right? So if it's definitely a result of direct pressure of the baby, then yes, the pain gets a little bit better. But for large majority, pain won't just go away completely. Round ligament sometimes goes away completely, but pubic symphysis, SI joint pain, back pain, they typically don't go away completely because they're not just a function of baby. They're a function of loose muscles, decreased activation, changed posture, changed muscle strategies. So it won't go away completely. I think the better way to say is some pains might get better. Round ligament pain might go away. Most pains will need some intervention.
Great. Any recommended footwear or shoes during pregnancy?
That's a good question. So we'll go over this later in one of the modules. Feet tend to flatten by 32 weeks. Again, hormones, more weight, posture, all those factors play a role. So arch is a little bit lower. And again, just because the arches are lower doesn't mean that there's pain in the foot. But some arch support shoes are better, not necessarily insert, but the shoes that support your arch, like have a supportive front to back kind of shoe. So I wouldn't wear like flip-flops. I also wouldn't wear heels just because there's a fall risk. We don't want that. But strengthen the foot muscles. That's very important through the pregnancy. And wear something that gives you arch support. Not necessarily, not like fancy arch inserts or anything, but something that is supportive through the arch, the shoe.
Correct.
So sneakers are fine, trainers are fine, that kind of walking shoe, aerosols kind of shoes are fine. But two things to know is, doing balance exercises so that the foot muscles keep working. Spending some time doing exercises barefoot so those foot muscles keep working, and then walking a long time, like keep walking, because that is the best workout for those muscles, best feedback for those muscles.
Good. Switching the gear. This person, I believe, is from Japan, and she or he is interested in the field of women's health. What is the first step, do you think, in getting started with that? So should he or she talk to like a specialist like you, or should they study like anatomy first?
Are they PT? Sorry, I missed that.
I believe.
Okay.
Yes.
So if they're
assuming
already,
he's a PT.
Yeah, let's assume they're already a PT. If they're already PT, then we have a professional course coming up, and that should get you started with most of the things. So you want to treat pregnant population. I'm assuming that's the goal, like not necessarily pelvic health with internal work. If you want to treat the pregnant population as an orthopedic therapist, then our professional series that's coming up after this is a good place to start. I'm going to go over, it's made for trainers and professionals and therapists who have a good understanding of anatomy. So I'm not going to tell you where humerus is or where rib cage is. I'm going to assume you know that, but I'm going to specifically go over what changes happen throughout the body during pregnancy, and how does that change your work as an orthopedic therapist, as a trainer, as a yoga person, or as an occupational therapist. Basically, I think that could be a good place to start.
Great.
And from there you can go into more deeper into pelvic health if you want to treat internally, and if you want to do more direct pelvic health. But pregnancy is often a good place, like good middle place. You're orthopedic, you're not pelvic health, but you're starting to understand pelvic health because you are externally treating or even thinking about the pelvic floor and its function. So it's a good jumping point or transition point.
And you told us last time that you recommend Diane Lee's books as a resource. And
yes.
Is it going to be too difficult for the starters to read the book from her, or?
Not as a PT.
Okay.
Not as a PT.
It's a good way to start.
Yeah. As a trainer, you may need to, keep your Gray's Anatomy Atlas with you, because she goes into a lot of details about fascia and everything. But not as a PT. As a PT, you should know that already.
Okay. Last question from us is, how long should you wait before getting pregnant again? Between pregnancies, how long? How much time should you allow?
So the official, or the usual advice is 12 to 18 months. Okay. I typically say, wait until a few months after you're done breastfeeding. So we don't want you to get pregnant while, and I'm saying this after you're breastfeeding because some people do breastfeed for longer, like they breastfeed for 18 months. So we don't usually want pregnancy during breastfeeding with hormonal imbalance, hormonal confluence, and feeding and providing nutrition to two babies is sometimes too much for the woman's body. So 12 to 18 months is what ACOG will recommend, American College of Gynecology, and most other organizations will recommend. However, it really depends on how old you are, right? Because if you are 38, I'm not going to necessarily say wait until 40, right? So we might say that, okay, you're good, go next year. So this applies to somebody who's younger and the age is not a factor. So if she's 25, yeah, that's fine. But I'm 35, and if I wanted a second baby, I probably won't wait that much longer. So that's a conversation to be had with your doctor also. How good is your reproductive health? How good is it for you to wait? And then you might want to decide if you want to stop breastfeeding a little bit sooner. There are studies that say you don't want to have concurrent pregnancy with a breastfeeding baby. One of those babies may not get enough nutrition from you.
Okay, thank you.
Yep. The next week's topic is urinary incontinence. So we're going to get into a little bit details about leaking during pregnancy. This is relevant for everyone who is also new postpartum, because they're often leaking for the same reasons after pregnancy. So why leaking happens, how you can prevent it, what you can do, and we'll go into a little bit detail anatomy of the pelvic floor. I'll show you what it looks like inside. Probably have a model in my hand next time.
Great. Thank you very much. Thank you for everybody to participate. We'll see you next time.